pediatric speech and language pathologist, and welcome to Teach Me to Talk's Therapy Tip of the Week. There are 6 ways that parents and therapists can teach late talkers, toddlers with language delays, and kids with autism to learn to communicate. If you'll master these 6 strategies, you will be well on your way to help teaching a child that you love to learn to talk. The second strategy that we're going to do would be with choices. Now, certainly, you understand choices, and as a therapist, you understand the power of choices, and lots of times parents are doing this instinctively, but some parents haven't really thought of this. They're kind of sticking to a yes-no thing with kids, and so sometimes they'll get kids that primarily communicate by that head nod and head shake, and certainly our little friends with autism may not have mastered that kind of gesture, but they're certainly doing things like turning away or lunging for something when they want it, when really if we get them to the point that they're imitating. Using choices is going to be a more natural way to facilitate a child's imitative words. And so again here, what do I mean by that? Well, he's still imitating what you've said. He's not having to come up with that word on his own or generate that on his own. And that happens, that's why a lot of our little guys have difficulty when we're asking them, what do you want? Tell me what you want to eat. What is this? Say this, that kind of thing, without really the model. I guess to say this wouldn't have been a good example there, but just with the model, they still need the model to be able to imitate what you said, but this just makes it a little more natural because there's another choice that they will not choose there. And so what is modeling? Again, it's just offering a child, do you want this or that? A little less echoic, meaning they're not going to say the whole thing that you've said. And it's something that most parents, again, do all day long. So why do choices work? And so why would that be our next little strategy that would be our go-to choice past imitation? Because it gives a child, again, what we were talking about, that communicative intent. It gives him a reason. He knows, oh, I've got to pick this. I've got to say this. And with this point in language development too, when we are really digging down and really working on this expressive language piece, we're not really going to take when a child reaches for something or a nonverbal answer, unless of course your goal is still signing or using a picture system or a speech generating device, whatever your method of communication is fine. But we're primarily in this podcast series, and where we are now talking about expressive language, we're talking about talking. And so we do want to hold out and have a child try at least to say the word and make the choice verbally with these choices. And so again, when we're using choices, when a kid is developmentally ready, now remember we said that he needs to be what? He needs to be imitating pretty consistently before we start a lot of choices. And a lot of times parents have offered choices and they'll say, Laura, that's not going to work because I've tried and tried and tried that. But I'll say, you were doing that before we really taught him how to imitate as well as he is now. So now's really the time to get back in there and this is how we're going to do it. And we talk a lot about the things that we talked about with the modeling. We want to model with a heightened affect. We still want to make it, here we can even do something better. And we did it with when we're talking about modeling, like the example we used in the ball, we had a visual representation of what we wanted the child to choose. And so a lot of times parents are doing that too. They're saying, do you want milk or juice? And they're holding both those options up. Now, when a child is a little further along with language development, we don't always want to provide those visual cues. We want him just to do it from auditorily alone. But right now, it's still a good idea, and it's certainly a way to help a child understand the choice-making process. Lots of our little guys with autism, especially when they're verbal, then they start repeating everything they hear. So I've said echolalia several times in the show already, but that really just means that they echo or they repeat verbatim. They repeat exactly what they've heard. So if you say something like, do you want a cookie or a cracker? What do they say? Cookie or cracker. They kind of say the whole thing. And that lets you know, gosh, they don't really understand this choice-making task in the first place. And so you can do some things visually where you want cookie or cracker, and you're doing that whole making it so salient and so important so that the child understands how important or what you're talking about. And it's just much more effective sometimes with a kid when you can give those visual choices too. I love choices because they're the best way to dramatically increase the number of words that a child tries in a short amount of time. And if you have seen my DVD, Teach Me to Talk, it's for free there on YouTube. So if you're watching on YouTube, you might want to jot yourself a little note if you haven't watched that yet, or listening to the podcast. It is available now for free for anyone to view on YouTube, and there's a section about choices, and you can watch some of those sections where I'm just offering choice after choice after choice after choice, and you don't stop with just one choice. Like, okay, so let's do an example so that this becomes really, really relevant for you. And I think this is the example that's in the autism workbook. But let's say that we're going to offer a child a choice of playing with, let's say, Bubbles or Mr. Potato Head. And we want him to pick Mr. Potato Head. Now, he may not be able to say Mr. Potato Head, but he says something that, it might be huff or, head or puff or potato or tato or however he says it. That's your first choice. Are we going to play Bubbles or Mr. Potato Head? And he picks that. And then, so then you don't just start opening the toy and start playing with it. You give him more choices. And I put all of my toys in giant 2.5-gallon Ziploc bags so that kids can still see them, and we've got that easy close, but then I can still maintain control of that toy. And until the kid really learns how to open it, and he's going to need my help to do it, and even though that's a pretty easy motor movement, I can still usually get the bag and withhold the bag and keep control of the bag without a child getting it. And it's a way to keep all your toys organized. And as a parent, you may have a different system or a therapist, but it's always nice to kind of do that where you have a way to still keep those choices going. And so then for that example with Mr. Potato Head, I might say, oh, okay, where are we going to play with the potato heads? We're going to sit up like we're sitting at the table, or will we sit down? And so your choices there would be up or down. And then once the child chooses where he wants to play, you say, great, am I going to leave the bag closed or open, and you want him to say open. And so again, you really keep that going. What should we get out first, the head or the shoes, and let him pick one of those. What comes next, eyes or teeth? And again, you should say, when you're holding the potato head, are we going to put the whole, put the teeth here? Where do they go, here or there? And you're always giving that forced choice question. Now, let me say something. Lots of children, when they begin to really imitate like this, will naturally imitate the last word that they've heard you say. And that makes sense because that's what they're holding right there in their short-term memory. And so to really, you can use it. The choice that you want a kid to choose, and as a parent, you know this a lot. When you're offering foods or something, you say, I know he probably wants this, so this would be a lot easier. It'd be great if he just would take this, and you're using choices. You can put the last choice, put what you want the child to choose as the last choice. But some kids, again, are just picking the last choice, and they haven't really assigned meaning with what they're saying yet, so they're always going to say the last choice. And so then what you have to do is to be a little trickier so that you put the first choice is probably the choice that he's going to choose, so that he learns, oh, I've got to listen for both of these words, and I've got to say the right word to get it. So you can certainly use those options either way. But choices are really, really important with kids. And again, like I said, a super, super way to bump up the number of words that a child can say in a short amount of time. And that really, I used the word primed before, that really primes his little system and really gets him ready to talk and gets him used to talking. And sometimes as a therapist, you might notice this. A parent will say afterward, he was exhausted after therapy today. I mean, he was asleep before we left the parking lot. Or you'll notice that a child that you've really kind of pushed, or if you're doing home visits, a parent might say to you, boy, he is worn out the rest of the day after speech. I want you to come, at this time so that he's going to sleep really good after that. And so you certainly know how hard it is for those kids, again, to talk, but choices just really amp that up and just get children used to responding in that faster paced way. And we know with lots of kids with their systems, they have to be so on like that so that they really can, for lack of a better word, perform. And so certainly getting those fast-paced choices are a way to get that going. I talked about this before, but I'm going to mention it again. Another main reason that choices are so effective is because they they give children the illusion of control, or they teach them how powerful they are, that if they can use words and use them effectively and efficiently just to accomplish things much easier than screaming for something or crying for something. And it's much easier to tell mom what you want than for her to have to stand there and figure it out. And so again, choices really, really get that going. And kids like that power, and kids like to be able to make those choices. And you'll notice sometimes too with kids that that until we can get them really involved like that, they don't really care too much about what you're doing. So it certainly is a way to increase participation as well. So we have to teach parents to offer choices all day long, and lots of times, again, to keep with a parent that this is not coming naturally for. As a therapist, you need to model that, and so you need to show them, with a toy like a puzzle, how you can offer the puzzle pieces, and keep those words and those vocalizations really going, and it not just be such a silent solitude play routine where they're just saying one or two things, and then you play for a while, and then you put it up, and then they get one or two things, they say one or two more words from the next toy, and then you play for a while and put it up. Don't do that. Really maximize your effectiveness with choices, and keep those choices going, and sometimes watch that, or recommend that parents watch that section of Teach Me to Talk so that they can see how that should look, or or you do that for them, even over a teletherapy session. You can really model that so that they can see how many choices that a child can make. It is not unusual in a single play routine to get 25 or 30 word approximations just within a few minutes by a skilled adult really offering those choices continually throughout that activity. So I hope that that's one that you're really able to use.